So I'd like to start off by talking about my 94-year-old grandmother. My 94-year-old grandmother loved to tell stories, and her favorite story was one that went something like this. I remember when Mark used to call our house and say, "Nana Torchia, can I come over and visit?" And I would say to him, "Marco mio," I'm Italian, "Marco mio, who's going to stop you? Come on over. Who's going to stop you?" That "who's going to stop you" has become, for our family, a phrase that we often use when we're faced with challenging problems. And we look at each other and think of my grandmother and say, yeah, who's going to stop you? So let's think about the development of NeuroBlate, that's what I'm here to talk about, and interweave that with opportunities through this development process where that phrase, who's going to stop you, really meant a lot to me and to others that were involved. So let's get back to the start of what we're here to show today. There we are. A brain tumor. That is a malignant brain tumor. Even if you're not a neurosurgeon, it's pretty obvious that that does not belong with the rest of the brain, right there. These malignant brain tumors, the median survival time is probably 15 months. And we know that right now, as I'm speaking, in North America, there are about 100,000 people with these types of tumors. And in fact, over the next year, we also know that about 20,000 new malignant brain tumors are going to be diagnosed. And unfortunately, about 15,000 people are going to lose their lives to this disease. We know that surgery is the very best option for these patients. But we also know that in many cases, the tumors are so deep within the brain, the patient's other medical conditions are so severe that operating on these patients is simply not possible. Now you think about that image and think about you going to see the neurosurgeon and hearing these 4 words. Your tumor is inoperable. So think about that. What does that mean to you? I know what it would mean to me would be, now what? And so this is where we start our project around NeuroBlate. Imagine if this same tumor could be managed with a very small device that could enter the tumor through a very tiny hole in the skull. So our goal was to build a device that would change the face of neurosurgery for tumor removal. So here's the idea. Imagine a probe that goes down inside the tumor. It has a laser that fires out sideways from the axis of the probe and is able to coagulate that tissue. So much like poaching an egg, raising it to a temperature where the cells in that tumor die. And then by rotating that probe and firing in another direction, we're able to very carefully sculpt the way that that laser interacts with the tissue. Because of course our goal is to affect the tumor, but not the normal parts of the brain outside of that. And we can repeat that process many, many times by rotating the probe, as you're seeing here, drawing the probe back, firing again, and continuing that process until the entire tumor has been coagulated. So that was our original idea, and I can remember thinking to myself, well, what are you waiting for? In somewhat an egotistical way, saying, well, now who's going to stop you? Let's get on with this thing and let's try to build it. So let me tell you a few stories along the way. In 1991, I submitted a grant, and at that time, people that had submitted grants were allowed to go into the review panels and talk to the committee. And I spoke about a prototype for the device, and on this review committee was a world-renowned neurosurgeon. And I'm going to use my notes for just a moment because I think what he said is really important. Everyone that was in earshot of that room heard these words. That's the most foolish, simplistic, and obviously could never succeed device I have ever seen in my life. You leave a meeting like that, and the only thing that you can then say to yourself is, who's going to stop you? By the way, I also heard that later this neurosurgeon also said that CT scanning was a passing fad. So back to the lab for more thinking time. And from that thinking, a prototype on a piece of paper was built. Then we traveled to an MRI site where there are a number of world-renowned MRI physicists sitting around the table, because we knew that if we're going to be doing this, we needed to use an MRI so that the surgeon could watch the treatment while it was happening, watch what the temperature was doing, and being sure that the boundaries of the tumor weren't being affected. So I did my 2-minute presentation, talked about what the prototype was going to look like, what we were trying to achieve, and it was amazing. Suddenly the room kind of lit up. There was whispering, there was shouting, there were people pointing at each other, there were clacking of tongues. It was this frenzy of activity. And all of a sudden, the leader of the group stood up, cleared his throat, took a drink of water, said, "Well, Mark, the general consensus in this room is it's impossible." Once again, drawing on that, my grandmother's phrase, "Who's going to stop you?" Back to the lab. Back to build a prototype that we could actually begin to show people and explain what was it that we were really trying to do. I've actually brought parts of that prototype for you here today so that you can see. So now imagine that this podium is a laser, and in fact, in the days when we were doing this, the laser was approximately this size. There were no fiber optics that could take the laser energy that we wanted to use, so we had to build a waveguide, which my shop vac gave up very kindly for me, this tube that's going to mimic that. Explain getting this on the airplane. We then crafted a stainless steel probe, which you can see here. And you're all thinking, what does that cassette take to the probe? So at that time, there was no fiber that could carry it. There was a little prism on the end here. And we knew that when we were firing this thing inside of a brain, we were going to get tissue stuck to it. And so this cassette had a little band of plastic that ran around here. And every time the laser fired, the plastic moved a little bit to give us another clear shot at the brain. So pretty crude device. But I knew what we were trying to do. And so I had dinner with a fellow in Boston. He was one of the inventors of the fiber optic endoscopes. And I think many of us are familiar with that, especially those of us that are over 50 and have had colonoscopies. I tried to explain to him at dinner what we were trying to do, and I said, you know, what we want to do, I brought this without the vacuum cleaner hose. I brought this and said, it's pretty simple. All I want to do is make this thing 3 millimeters in diameter and make it completely compatible with a magnetic resonance imager. And again, I remember this very distinctly. It seared into my brain. He stopped chewing. He very carefully swallowed. And then he started laughing. And he laughed, and he laughed, and he laughed. For the rest of the dinner, he laughed. And his reaction to it was, yeah, good luck with that. So again, it became, and I relied on that phrase, now who's going to stop you? Shortly after that, I made one of the very, very best decisions of my life. Now, in the context of life, it's not as good a decision as marrying my dear wife, who's here in the audience, or having 2 amazing kids. But it's the next one from that, and that was to begin to work with and hire Richard Tyc, who's sitting right down here in the front. You might as well get up, Rich, so people can see you. So engineer extraordinaire, no question about it. And of course, now he's my friend and colleague and is obviously a co-winner of the Manning Award with me. But I hired Richard to start on that idea about how do we take this and turn it into something that we really would poke it into somebody's brain. So we racked our heads for months and months and months and months about how to shrink the technology, about how to create a device that could cook that tumor but not damage the tissue around it. We brought other people to the team. We brought software engineers, we brought other engineers, we brought surgical technicians. We had a wide range of people finally working with us. And then one day, well, I consider it a miracle, this happened. So you're thinking, nice, what's that? All right, here is the hole that we put our probe in. This is a piece of kidney tissue that we purchased at our local butcher. Here is where that probe is going in, and you can see this nice, healthy pink tissue around here. And here you can see this triangle of coagulation. Nice, healthy tissue on both sides, triangle of treated tissue. And at that point, we looked at each other and thought, yes, we have actually done this. And the phrase began then, now who's going to stop us? Over the next few years, Richard's engineering team enhanced the system, and we received permission from the Food and Drug Administration in the US to use it in a clinical trial. And here's what the real probe looks like. Well, there it is. Aren't you glad I hired Richard? So in spite of all those years of very, very careful planning and testing, I can tell you that those very first patient experiences remain firmly cemented in my head, and I'm sure Richard's as well, as being, quite frankly, the most terrifying thing I have ever done. You're standing in the operating room, the neurosurgeon's looking at you, the patient who's now asleep is thinking, I sure hope they knew what they were doing. My inner voice is saying, man, we are actually going to stick this thing in someone's brain tumor and cook it. What are we thinking? At the same time, our outer voices and our body language, very relaxed, very confident. This is going to work. I have complete faith in all 4 million lines of code that is driving this thing. So, what was the result? Well, let's take a look. This is an MRI of one of the very first patients that we did. I'm sorry, some of you on this side won't be able to see it, but there's the original tumor that was very deep in the brain and couldn't be treated in an open operation. Here's the image after the surgery, and you can see that this tumor has actually kind of changed characteristics on MRI, which is an indication that it's been treated, but you also see this very tiny hole here, and that was where the probe went into the tumor. Now keep your eye on this. That's 1 month later. That's 6 months later. And that's 1 year later. One year later, with a tiny scar in the bottom of the brain, that patient is now over 4 years out from the time of this initial surgery. So let's skip forward a few more years now. 30 hospital sites in North America. And just a few weeks ago, 7 patients were treated with NeuroBlate in 1 day across the US. Was the journey difficult? Yeah, you bet it was. I think the journey was far tougher than either Richard or any of us could ever imagine. Was it worth it? You tell me. So, be an innovator. Pick a cause, pick a need, use your talents and ability to make a difference. Change the world in some positive way. And remember, who's going to stop you? Thanks very much.